PCOS is a well-known cause of infertility in women, but did you know PCOS can also increase your risk of miscarriage once you become pregnant? In fact, the rate of miscarriage among women with PCOS is as high as 50%. That's 50. Hi, I'm Robin Nielsen. I'm the Chief Wellness Officer here at InsulightHealthPCOS.com. Are you dealing with the devastating and frustrating symptoms of PCOS? Please know that you're not alone. Like millions of women worldwide, I too suffer from PCOS. It's a health condition with serious consequences. A miscarriage is a heartbreaking tragedy for any woman. I experienced this firsthand when I had my miscarriage with my third child. But it's especially tragic when pregnancy is difficult to achieve in the first place, or if you've been told by your doctor that you'll never have a child. I've heard this story from so many women. They've given up hope. It's important to know that PCOS is the leading cause of female infertility, and women with symptoms of polycystic ovary syndrome or hormonal imbalance often struggle to become pregnant. If you finally do become pregnant, PCOS can cause a number of complications, including a greater likelihood of the miscarriage prior to the 24th week of pregnancy. The hormonal imbalances in PCOS cause irregular ovulation or even lack of ovulation entirely due to higher than normal androgen or male hormone levels. High male hormone levels are caused by insulin resistance. Insulin resistance is your body's inability to get blood sugar into your cells to use as fuel, because insulin is the key that gets sugar into your body's cells for energy. Additionally, there are studies that show hyperprolactinemia or high prolactin levels can be a factor in infertility in women with PCOS, which is also caused by higher estrogen levels or central neurotransmitter dysregulation. Whew, a lot of scientific talk here. But they can both be present in women with symptoms of PCOS. These factors can make it impossible to become pregnant. But PCOS should not rob you of the ability to become pregnant, nor the positive, healthy pregnancy outcome you desire. The good news is you have all the power to heal your body to become pregnant and carry a baby to full term. We've seen this happen so many times with our PCOS 5-element system. We're the leader in naturally reversing PCOS symptoms and restoring the proper balance of hormones. Here's some feedback from one of our beautiful women in our community, Teresa Parsons. She writes us, 3 years ago, I was diagnosed with PCOS when I went to my gynecologist because I had not had a period in over 6 months. He told me that PCOS meant I could never conceive children. I left that appointment feeling devastated. I went home and did a basic search for PCOS, and the Insulight website was one of the first things that popped up. I began the PCOS 5-element system, and that next December I found out I was pregnant. My son was born in September 2013. Over these last 3 years since I started on my Insulight journey, I've preached the Insulight gospel to all of my friends. I now know of 3 other Insulight babies besides my own. And another woman, Chelsea, wrote to us, I recommended the system to a dear friend of mine. Her symptoms seemed worse than mine. After she had been on the system for 2 months, she was pregnant. This is after years of trying, many miscarriages, and doctors telling her that she'd never carry a child. She has a beautiful girl now. We have many stories like this. The Insulight system combines essential nutrients, carbohydrate craving awareness, food as medicine, movement as medicine, and support to give you the best chance for overall good health for fertility. Are you ready to be proactive about your health? If so, please explore PCOS.com for more information. There you can find out how the PCOS 5-element system can benefit you. We're here to support you every step of the way.